This is a picture of hysteroscopic septectomy before and after surgery. Those patients exposed to diastole, sylvester, exposed to uterus, uterine cavity compromise, T-shaped uterus, small cavity in 57, small uterus yellow in 19, small uterine cavity in 13, T-shaped uterus constriction rings 13, constriction rings yellow in 4%. Head Kaufman. This is the left side is triradiate uterus. This is T-shaped uterus, lateral spurs and arcade fundus. Odd ratio for the inability to conceive. Upper uterine constriction 2.2, T-shaped cavity 2.6, Kaufman. Reproductive outcomes in T-shaped uterus, highest abortion rate 47%, lowest term delivery 21%, at a Golens. Diastole, sylvester, related uterus, T-shaped uterus initially for surgical treatment, hysteroscopy, metroplasty using semi-rigid scissors for non-phasal anomalies. Live birth rate report in 3 out of 5 patients with recurrent pregnancy loss, like into Negris and Mallow. This is technique used under Resectoscope guidance. Already Korean has covered this one with the incision of the lateral walls as the thickening of the fundus. You have to insert that one to make the uterus wide. This is called lateral metroplasty to make the uterus wide. Resectoscope incision, pure cutting, fundal lateral incision of the constriction rings and uterine walls. Adequate cavity and cornal access achieved. Post-operative therapy, intrauterine balloon 3 ml for 5 days. Give estrogen progesterone for 1 month. This is called lateral metroplasty. This technique, same technique they are doing in uterus diadyl first. Cut the uterine septum, leave the cervix septum. Nowadays they are doing in case of uterus diadyl first. About digital exposure in vitro constriction rings around the proximal uterine tube, T-shaped uterus are arched base. Plastic enlargement metroplasty to widen the cavity by making crucial incision on the excess muscle tissue lateral on the, located on the uterine wall. Surgery done in 61 patients, 37 pregnancies achieved in 16 months. And some results are excellent but difficult to measure the functional results. Abroad saffron. This is called lateral metroplasty, pre-metroplasty and post-metroplasty. Lateral metroplasty that increases the uterine size, cavity size by 20% in 22 cases. A comparison study was done, post-metroplasty in primary infertility 44%, in secondary infertility 42% pregnancy rate achieved, according to Seria 2007. The study was done between septectomy and lateral metroplasty. Pregnancy rate was achieved in septectomy 86%, metroplasty 76%. This study was done by Ramaraju in 2006. Quality of evidence of effectiveness of hysteroscope and critical pregnancy rate following failed IVF cycles. He did 255 cases. After surgically corrected 37 cases conceived. After normal hysteroscopy also they conceived 44. This was published in Archives of Gynecology and Obstetrics 2006. That is the advantage of hysteroscopy, better do before IVF cases. This is a risk. Hysteroscopy surgery is not without risk. Any surgery there is risk. More careful while doing hysteroscopic surgery. It may injure the uterus, bowels, anything. And contraindications are pelvic infections, uterine bleeding, cervical cancer, pregnancy, recent uterine perforation should not do hysteroscopy. These case reports are done. Three recurrent abortions. I did hysteroscopy, diagnosed hysteroscopy, found septum, that is incision with needle. Just as shown Korean Joseph like that, without any resectoscope, simple 2.9 hysteroscopy with needle, operative hysteroscopy, incision that septum. Patient conceived after 3 months. or a continuing pregnancy. This is along always mandatory do hysteroscopy along with laparoscopy. That routine hysteroscopy found polyp, they removed the polyp. This is patient in the case of intermittent Seineke-Asserman syndrome. Patient came with amenorrheic, she is ovulating. Hysteroscopic shows multiple defects. I posted for hysteroscopy, I did make the cavity additional lysis. Afterwards, I kept the copper T and give the estrogen for 3 cycles. Patient is menstruating, not yet conceived. This history of menstruating cycles, which is since 2 years. Patient had MTP 2 years back. I did scanning, shows almost 58% of the baby inside, organized, calcified. That case I did removal of the products, bone particles. Patient now she is menstruating. This small submucous polyp are removed with resectoscope. About conclusion, hysteroscopy considered a golden standard to diagnose intermittent pathology. Additional lysis restored uterine function in 94 cases and improves pregnancy 23 to 53%. Pregnancy rates are low in cavity distorting myomas, where myomectomy is beneficial. The frequency of unsuspected intermittent pathology is recurrent implantation failure, 18 to 50%, on which correction improved pregnancy rate. Among the infertile couple, hysteroscopy should be mandatory, along with laparoscopy. If more than 6 cycles failed, had to go for laparoscopy. I am very thankful to Ramaraju for giving me this opportunity.